And we are back. So here what's going to happen is that you'll be able to see that if let's say there are three steps in this reaction. So what's going to happen is that these antibiotics will be able to have an impact at two different points for the reaction to occur. So in the case of sulfonamide, it affects only for the first point here, whereas trimethoprim is able to affect at this particular point. So when you use only either one of them, it only blocks one of the reactions. On the other hand, if you're to use both of them, you're going to end up having a more effective method of inhibition of your metabolic process. Okay, all right, I hope that helps. I'm going to go on next. We have this thing called the plasmid-borne resistance. Now, very often you've heard of, oh, this antibiotic is now no longer effective in killing all these diseases. You mentioned earlier on when I told you about penicillin not being effective anymore. Doctors don't give people who are infected with bacteria with penicillin, because many of these bacteria have been are very well resistant to this antibiotic. So how does this happen actually? It's mainly because there is this circular DNA. You need to understand something. I'm going to point to you right now. You can see down here you have the circular DNA of your bacteria. Your bacteria have got a circular DNA. The DNA in our body, in the nucleus, all the DNA is linear. They are pieces of threads. There's two ends. Whereas in the bacteria, its chromosome is actually a circular DNA. Now, this is the main genomic DNA, which means that for the bacteria to be alive, this chromosome or this DNA must be there. You take it out, the poor fella is going to die. Okay. Now, on the other hand, sometimes outside of the of this chromosome, you have this thing called the extra chromosomal DNA, which is actually also circular, but it's a very small DNA. Okay. Now this circular DNA, they also contain gene, and very often they contain gene that codes for an enzyme. What does this enzyme do? It digests. What does it digest? It digests antibiotics. Can you believe it? So if it digests antibiotics, that means the antibiotic will be broken down. So if the antibiotic is broken down, will it have an effect on this bacterium? No, it will not. Now, okay, hope it's clearer for you. So remember, for this bacterium to be able to be killed, you need to have a bacteria that doesn't have this plasmid that codes for a gene for making proteins or enzymes that can break down that antibiotic. So if it has such a resistance gene contained in the plasmid, finish. This bacteria will be able to go on living in the patient, and the patient will not recover from the infection, because you keep on giving the antibiotic, useless, because the bacteria is happily getting rid of the antibiotic on its own. So it is resistant as a result. So I hope you understand this concept. Okay, so the thing that is important for you to understand with regards to resistance is this bacteria have got this plasmid, right? It can pass this plasmid over to any other nearby bacteria. So if it passes it on to a bacteria that doesn't have this plasmid, what happens is that now this bacteria that receives this plasmid now also becomes resistant. So that is how resistance of antibiotics can spread. That's why in some countries, I do not teach you, so you probably do not know this. I travel quite a bit. I go to see my sister in Germany and London sometimes. So I've noticed that in European countries, when you've got cough and cold and things like that, if you do have a bacterial infection, the doctors do not prescribe antibiotics, because they want your body to combat it using your immune system instead of relying on all these drugs. Okay, because very often for us Asians, we have all kinds of remedies and treatment. So the moment we feel better, okay, I'm not going to take this anymore, I'm going to take my chicken broth or my chicken extract. So you don't take the antibiotic anymore. So the bacteria that has been slowly being killed, one by one being killed, right? So the moment you don't take the antibiotic anymore, those remaining bacteria that are still around, they sense, no more antibiotic anymore. Aha, now I can grow again. So that's how they can slowly develop resistance. So that is the reason why you, as a nurse, remember, you must teach your patient to comply with instructions about how to take the antibiotics. Take it at the correct dose. If you're supposed to take one capsule, take one capsule. Don't be clever and break it down into half lah. Oh, I want to make sure it's not too much for me. Or, it will affect my skin. I do not like it. I want to remain radiant. Don't be so hiao, okay? Take it correctly, okay? So take the antibiotic. If it's the one tablet, take one tablet. 3 times a day, make sure it's 3 different times with the correct duration in between. Not every 1 minute, okay, I'm taking one more. 1 minute later, okay, I'm taking one more now. Okay, this is my third one, okay, so I take one more. 3 minutes apart. Crazy, right? So please follow instruction. They tell you at 3 different times, every 6 hourly or every 8 hourly, follow accordingly. Don't be your own self-licensed doctor. Okay, tell the patient that. Okay, all right, of course not that rude lah. Okay, and then also sometimes you must also tell them, okay, complete the course. That's what they're told to do. Very often they don't do that, especially elderly. They would rather follow their witch's brew of, put all this chrysanthemum and all that, which is fine. I'm not saying it's bad. It's just that antibiotics, they need to complete, follow accordingly. Otherwise they cause havoc, like what's happening right now, where you got lots and lots of resistant strains of bacteria everywhere. Whose fault? All right, so please, your job, please do it properly. Yeah, all right, thank you. Now, this is a diagram to show you what happens when we have this bacterial resistance. What happens is that you have this bacteria, not so clear lah. I'm not sure whether you can see it clearly. This particular bacteria, well, this is supposed to be the outline of the bacteria, but it's not so obvious. I'm not so sure why. There's another bacteria down here. This bacteria, maybe what I can do is I change the color. Okay, it's actually a circle, but this part of the circle is not so clear. I'm going to draw in with my fantastic drawing ability. Okay, there you have a potato looking plasmid. Okay, quite horrible. Anyway, so there you have it. That is a plasmid, and that red part is the resistance gene, the recipe for making an enzyme. That enzyme, if it's made into a protein, that enzyme is able to break down antibiotics. Okay, so it will make this bacteria A be able to grow even if the antibiotic is given to it. Okay. Now, what you need to understand is that when this bacteria and this bacteria come close together, take note, this second bacteria that I'm drawing for you right now, it doesn't have a plasmid. So when they come close together, sparks start flying. Okay, they're going to come closer and closer, and kabong, something's going to happen. Guess what? Guess what? Ooh, I'm already sitting at the edge of my seat right now. What is going to happen? Make a guess. Make a guess. Come on. What do you think? Let's see now. Da, da, da. Ooh, they are having this thing called a sex pilus. It's a structure that is like a tube that, okay, this particular structure is going to be passed down from this bacterium over to this other bacterium, which does not have the plasmid. So it's a tube, okay? And what's going to happen next? Guess what's going to happen, okay? It makes a copy of this plasmid and passes it right across, going over here. And guess what happens to this DNA that's going over, this plasmid is going over after this? It will eventually form another plasmid down here. Finish. Now this bacteria B also is resistant to the antibiotic. So now this is how you can spread resistant gene from one bacterium to another. Okay, so please understand, that's why it is important to kill those bacteria or stop them as quickly as possible before they are able to spread this resistance gene to all the other bacteria. Okay, this is your job, this is our job. When we are patients, we must comply. When we are doctors, we must make sure we give the correct antibiotic and the correct dose and all that. And as nurses, you must explain to your patients so that they will comply. Okay, make sure that they are not self-licensed doctors. Okay, remember. All right. So, what happens with drug resistance? Well, it's an adaptive response, so the microbe will be able to become resistant. Okay, it can tolerate. So you give antibiotic, go ahead. I'm not dying because of your antibiotic. I can go on infecting this host. Okay, so that's what's going to happen when it's become resistant. Okay, so even if it's a small number of them, they can grow. That is a problem, and they can spread to other patients. So that's important. You need to see that later on. When you go to the hospitals this semester, you won't be going out to the this particular, at the end of this term you won't be going out to the hospitals, but at the end of the semester you'll be going to the hospitals. You might go into wards that you might see it says MRSA. We'll talk about MRSA very soon. These are Staphylococcus aureus that are resistant to certain very strong antibiotics. We'll talk about that very soon. Okay. Okay, now MRSA. What is MRSA? Well, it is a strain. You know that all living organisms, they've got two parts to their name. The first part is the genus name. I'm underlining for you right now. That's the Staphylococcus is a genus name. I change color now. Staphylococcus is a genus name and aureus is a species name. So what you get is that there is a strain which is referred to as a methicillin resistant strain. What is methicillin resistant? That means this Staphylococcus aureus is resistant. Resistant to what? To this antibiotic called methicillin. Okay, so this is not an ordinary Staphylococcus that you find in your nose. This is your Staphylococcus, but special. It is resistant. Naughty fella. Okay, so MRSA infection, when you get them in the hospital, it's a nosocomial infection, and very often when you go into a ward that says at the door, it says MRSA ward, it means that the patients in there, they have got an infection with this Staphylococcus, and you give them if you give them methicillin, no point. Okay, so if you are a patient with an open wound, you walk into a ward like this, you get an infection on your open wound, and if the doctor tries to help you heal faster with methicillin, it won't work. So this is a bad thing. So you need to understand the concept here. Now, okay. So MRSA is a short for methicillin-resistant Staphylococcus aureus. Aww. Okay. So it means that it is very, very strong because this methicillin is a strong antibiotic. So if it is not killed by methicillin, can you imagine all the other kucing korap, all the low-class antibiotic, also no effect long. Got the idea? Can you understand the concept now? So this is quite a dangerous thing. You have to be very careful about this. Okay. So instead of using methicillin, so people who are infected with methicillin-resistant Staphylococcus aureus, doctors prescribe a stronger antibiotic. What is the name of the antibiotic? Let me change color for you. They use vancomycin, another even more powerful antibiotic. Okay, so vancomycin, ladies and gentlemen, is none other than a very, very strong antibiotic. Okay, and guess what? Even this commando trained antibiotic has failed now, because in the year 2002 it was discovered that there is a new strain of Staphylococcus aureus, and they are even resistant to the vancomycin. They are even bigger gangsters now. So how to combat now? So they need to find even better antibiotics. There are lah, okay. But how fast can we find new antibiotics? Because this bacteria, they are getting resistant to antibiotics much faster than we can discover newer drugs. So that's why we need all of you to be able to work together to enlighten those patients. Better cooperate. Don't be xiao. Okay, all right. All right, so now to be able to minimize or to be able to prevent drug resistance, what we normally do is that we try to ensure that doctors do their part of being able to diagnose diseases and be able to know what will be the best antibiotic to prescribe to the patient. Okay, so that is whose job? Not yours, doctor's job. Okay. Second point, patient compliance. Whose job? Patient. Okay. Third one, administration of 2 or more drugs. Who can do that? You are. Cannot also lah. So this is none of your job. Am I right? This is all doctor's job. Is that true? No. Look at point number 2 properly. You cannot trick. No. Point number 2 is actually mainly your job, because only when a patient understand what is his role will he be able to comply, don't you think? So it is where you apply your nursing, your communication in nursing practice, CNP and all that, right? And you learn how to communicate with them properly, and you need to know how to empathize, help them understand better, use the proper language, make them understand, make them tell you once again what they have understood, so that you will be able to see whether they have misunderstood you. So make sure you communicate with your patient and make sure they will be able to understand properly. All right, so that's your job, mainly point number 2. All right. And then when we talk about drugs, if let's say we have a patient who have got an infection, you want to quickly be able to identify a suitable antibiotic to be able to be prescribed to the patient. Am I right? So very often, what the doctor will do is that they take a sample of the pathogen from the patient where the site of infection is. If let's say it's a very, very severe sore throat, the doctor will do a throat swab, get the swab, put it into a little tube that contains some culture growth medium in a sterile container, and then it will be sent by a pneumatic system all the way down to the lab, the laboratory medicine department. So the laboratory medicine people receive the sample from the throat swab, and they will culture the bacteria. Remember, listen very carefully to what I'm going to tell you right now. They will culture the bacteria from the throat swab. So it will contain a lot of the pathogen from the swab. Am I right? Will the pathogen be the only bacteria found in the throat? Of course not. There'll be others as well. There'll be those which are from the microbial flora in the throat as well, right? So the job of the technicians in the laboratory will be to purify a culture of the pathogen alone. First step. So it will be a culture. Culturing means growing and making sure you get a pure culture. Pure culture of the what? All the normal bacteria, is it? No, those are the waste of time. You want to culture only the pathogen. So if it's a throat infection, that means it's likely to be streptococcus. Am I right? Remember or not? Forgot online easy. Streptococcus, not staphylococcus. Okay, Streptococcus pyogenes. Okay. So the technician in the lab will purify the culture. Once they got the pure culture of the pathogen, then they will test using different antibiotics to see which one will give a zone of inhibition. You have seen this in your previous lecture, in which you have this agar that's red in color. You see that there's an area where there's botak growth. The bacteria does not grow. It's what we refer to as a zone of inhibition. They will measure the size of the zone of inhibition and check it against a list and be able to determine, aha, this antibiotic is good because the bacteria or the pathogen is sensitive to this antibiotic. So they can recommend to the doctor that this antibiotic can be prescribed. Okay, so you need to understand how we work. So what we do is we collect a sample, culture it, and then we do the sensitivity test. So in medical term, they call it CNS, capital C, A-N-D, and S. So it's capital C and S. C, S. Okay. So C is for culture. Culture what? Culture the pathogen. Okay. What is S? Sensitivity. Sensitivity of what? Sensitivity of the pathogen, whether it is affected by the antibiotic. Understand? So once the report comes in from the lab, it is sent to the doctor. The doctor receives it, and then they will go to the patient and say, okay, are you allergic to any of these antibiotics? And the patient will say, okay, I am allergic to tetracycline and only nalidixic acid. All the others I'm okay. So if that is the case, that means the doctor will look at any other sensitive antibiotics for the pathogen, and the doctor can prescribe accordingly. So that is how they perform the CNS, and the knowledge of which antibiotic is suitable is important for the drug susceptibility. Right? Okay. Next slide, let's see what happens next. This particular slide is to show you the Kirby Bauer test. Okay, you see the area where there's no bacteria growing. So I'm going to draw out the area where it is a zone of inhibition on this actual diagram on the right. So I'm going to draw it out for you. That botak area where there's no bacteria growing, and also watch. The green color not so nice. I'll make it red color. Red color. Let's take a look at the red area. So I'm going to draw it out. Can you see the area where there's no bacteria growing at all? That is the area where we have zone of inhibition. I'm shading the area where there is botak completely. Now that area is referred to as a zone of inhibition. I'm going to use a yellow color line to tell you how they measure the diameter. So my lining is not so fantastic. I'm going to try, okay? Now look at the yellow color on that red area, okay? You measure from that point right across through the center of the filter paper that is white in color right across to the opposite end. Okay, fantastic. My line is not a straight line at all, but you get the idea lah. Okay, so that diameter you measure, and then you subtract the diameter of that paper. That value that you get, you measure against a list. I'm going to show you in the next slide. You measure against the list. So if the measurement falls within the category of sensitivity of sensitive, then you rate that this pathogen is sensitive to the first one. It says the pathogen is sensitive to bacitracin. This antibiotic this chloramphenicol is also effective because you can see that the pathogen is also sensitive to chloramphenicol. So if it's rated S, it means sensitive. That means it can be used for treatment or for the combating of the infection. So the doctor can prescribe. If it's S rated, it is good for giving to the patient for treatment. Okay. If it's I, that means it's intermediate. It's okay lah, not so fantastic. Okay. Yeah, okay, not so fantastic lah. Okay. S, also another one. Gentamicin is also very good, so can give. Kanamicin, also good, can be given also. R, don't waste your time. The doctor will completely ignore. If it's R, means the pathogen is resistant to neomycin. Lousy, puyao, don't want, cross it out. Lousy, hopeless. What about penicillin? Of course, hopeless fellow also. Okay, it's a very outdated antibiotic anyway. Okay. Streptomycin, also lousy, throw away. No need. Tetracycline, can, very good, works. Vancomycin, yes, very good, it works. So you can tell, okay, when the doctor says, ask the patient, okay, Mr. Lim, tell me, are you allergic to any antibiotic? So the patient say, oh, sorry, doctor, I am quite allergic to a number of antibiotics. I am allergic to tetracycline. I am allergic to gentamicin. Everything else, I'm okay, no problem. I know that I'm allergic to these two drugs. So that means what you can do is, as a doctor, you can prescribe bacitracin, chloramphenicol. You can also prescribe kanamycin, vancomycin, not tetracycline for sure, because you might end up killing him instead. Okay, you also cannot give him gentamicin because he has already told you he is allergic to gentamicin as well as tetracycline. Is that clear? Okay. So I hope that's a little clearer for you. I think that's pretty much it. Let's take a look at the understanding of the meaning of the word synergistic. I've already explained to you. Synergistic means that if you give these two drugs together, it complements each other. It makes the effect of killing or stopping the bacteria from growing even better. So as a doctor, you want to try to find drugs that will be able to work together to help, because the ultimate aim of therapy and treatment in patient is to be able to make sure you can make the patient recover faster, right? Now, the patient can leave the hospital, come back to his normal life all over again. So that's the whole idea. So that's what we try to aim to do. And drugs only help in terms of medication. But if you as a nurse can do a good job of encouraging the patient to cooperate. If you can make the patient drink enough water, make sure he gets enough rest, and so that he's not on the phone all the time talking away, or trying to buy stocks and shares all the time, so he's always stressed, so that way he will not be able to recover well. So you as a nurse, you need to be able to highlight all these things so that the patient can recover faster. Recover faster means he can leave faster, he can save more money from all the hospitalization bill. So help him understand all that thing as well, okay? Because we are always running out of beds in the hospital. So, all right. So I hope that helps. What is the last point? Aha, these are the references. And the very last point down here is an example of what you can do to be able to see how we can make measurements and check against the list to be able to see whether a drug is appropriate, whether it is susceptible. The word susceptible is used down here, so I want to highlight the word susceptible down here, as you can see the yellow line. Okay, so that yellow line is telling you the word susceptible. The earlier one we use the word sensitive. They mean the same thing. Okay, that means the pathogen or the bacteria is susceptible to the drug. That means it's affected by the drug, or it is sensitive to the drug. So sensitive or susceptible means it is either killed or stopped from growing. All right, important point to understand. Okay, so if we are to look at all the values, watch my I'm going to change back to the red point again. If you were to look at ampicillin, it's 17. That's the diameter, the zone of inhibition. If it's 17 down here, let's look at the bottom part in table 2. The rating based on the recommendation is, if the zone of inhibition is 14 or more, you should rate that the pathogen is susceptible or sensitive. So because what you've noticed, the pathogen gives a zone of inhibition of 17, that means the ampicillin is effective. The pathogen is susceptible to ampicillin. So you can give this ampicillin to the patient for treatment. Okay. What about erythromycin? Up here in table 1, it shows 26, am I right? It is a good zone of inhibition. But what about the table number 2? It says if it's 18 or more, it means it's susceptible. So can you give? Yes, because your rating from table 1 shows that it is 26. So it requires 18 or above. 26 is definitely above, so that means you can give erythromycin as well. Isn't it wonderful? Great. So let's take a look at the next one down here, penicillin. Okay, so penicillin, the rating that you see from the actual Kirby-Bauer test is only 25. For it to be effective, it must be how much? It must be 29 or more. Can it be used? Is it useful? It's hopeless. It's useless. So forget it. So in this case, it gets a rating of only intermediate. Not worth wasting your time on. Okay, not that great. It's just intermediate. Okay. Let's take a look at the even more hopeless situation. Let's take a look at the last one. I'm going to change to a blue color. Is blue color good? Let me see. Maybe green color. Is it good? Yeah, maybe green lah. I'll pick green color for you. Okay. Now let's take a look at the rating from the actual measurement. Actual measurement, it is 11 in table 1. You look at your table 2. The rating must be 19 before you consider it for treatment. What? Is it useful? 19 or more, but what you get is only 11. Useless, forget it. What about intermediate? Is it in the intermediate category? Hello, it's 11. Is it anywhere between 15 or 18? Hello, maths, you should know, right? No, it's smaller than even 15. So useless, forget it. Don't even consider it. And where does it come under then? Okay, 14 or less. So that means it comes under resistance. So do you waste your time? Forget it. The doctor won't even look at it. You won't even prescribe it at all. Waste of time. So that means you don't even consider tetracycline for therapy. Got it? So I hope you're clearer about this. So has your BCR session for MIC been useful for you? So if there is really an outbreak, you know what to do. Play your part in trying to break the chain of infection by keeping yourself away from where the source of infection is, because in so doing you are keeping away from the reservoir of where the infection might be. And because you are at home, that way you are also making sure that you are protected. And so that way, if let's say you are a susceptible host, if you happen to be near the reservoir, you might pick up and you will be continuing the chain of infection, which is not what you want to do. So by keeping away from where the reservoir is, the susceptible host, have prevented yourself by being physically away from where the source of infection is. So get the concept? So you need to understand that when you learn, you make connections every time. So I hope it's useful. So I also hope that for the next lesson that you're going for, you are all charged up, and I hope you've gotten enough rest. All right. So all the best. Take care. I hope you've enjoyed yourself. Bye-bye.